Hello, my name's Olivia. I'm with Leadership Initiatives. I'm going to be an intern. I'm helping you with your diagnosis and treatment today. Is it okay if I ask you a few questions?
Hello, Olivia. My name is Dr. Hamza. I am
Nice.
going to be your guide to make your diagnosis. So your patient is ready. You can go ahead and ask all the questions that you want to ask.
Okay. What is your name?
Wait, Miss Sunanta. Yeah? Okay, her name is Aisha Suleiman.
It's so nice to meet you. How old are you?
The current Sana. Yeah? Okay, she's 4 years old.
She's 4 years old.
Yeah.
Could you tell me a little bit about what it's like at home?
Okay, so wai kamar ya rayuwar ku yake a gida? Ku nawa ne ya kuke zama a gida? Kin ga? Eh, mm, ki kaɗai ne matan? Mm. Okay, she actually stays with her parents, both
Mm-hmm.
her dad and her mom. She
Mm-hmm.
has four other siblings. She's the youngest among them. Yeah,
Mm-hmm.
and she's yet to be enrolled in school.
Mm-hmm. Has she had any diseases or taken any drugs to help with that in the past?
Wai da tana da wani ciwo da aka santa da shi ne? Okay, she doesn't have any known illness and has not been on any medications in the past.
Are there any known influences of family disease that they've had in their family?
Okay, wai akwai wani abu ne kamar da yake ake da shi a gado ko wani abu a gida na ciwo. Ba a gadon shi. Okay, she does not have any family influences of disease, actually.
Okay. What has brought you in today? What are your symptoms?
Wai me yake damunta yanzu? Sai me? Okay, she's been having this fever for the past 2 days with associated abdominal pain.
Hmm.
And sometimes when she's passing urine, she experiences some pain when she's passing urine.
Okay. Could you tell me a little bit more about your stomach pain? What would you rate it on a scale of 1 to 10? 10 being the worst.
Wai kamar ciwon cikin nan, za ta iya kwanci a jikin ki. Kamar ciwon cikin nan kina gani kamar idan aka ce yana da tsanani ne sosai ko kuma ɗan kaɗan ne. Eh? A yana da tsanani sosai ne ko kuma ɗan daidai daidai ne ko kaɗan. Okay, she said she'll give it a 5.
A 5. Have you had
Yeah.
any fever?
Wai akwai zazzaɓi ne? Yes, she actually has a fever.
How long have these symptoms been lasting? A few days or how long?
Yeah, a few days, 2 days to be precise.
Could you tell me a little bit about if the fever is consistent, if it's getting even worse, or if it's on and off?
Wai zazzaɓin na yana yana nan ko da yaushe ne ko yana zuwa ya ɗauke. Okay, the fever is actually in on and off, but it's usually worse in the evening hours.
Worse during the evening?
Yeah.
Okay. Have you had any headache? Has your head been hurting?
Wai akwai wani ciwon kai ne? Okay, she doesn't have any headache.
She doesn't have any headache. Have you
Yeah.
been vomiting or been nauseous?
Okay, amai fa? No, she doesn't have any nausea or vomiting.
Okay. Have you felt any, have you been itching at all or have had like bumps on your skin?
Wai akwai kuraje ne ko ƙaiƙayi? She doesn't have any rashes or itching.
Okay. Has she been tired lately?
Wai tana saurin gajiya ne? Kwanan nan? Mm. Yeah, actually has some low energy in recent times. Yeah.
Okay. Could I see her hands?
Okay. Ba za ta iya ganin hannunta? Haɗa kamar tana so misali ga naki ga nata. Ko? A cikin matso da shi kusa da kamera.
Okay, thank you.
Yawa, ta gani.
Thank you. Have you taken her heart rate or is her heart
Yes.
rate increased?
Yeah, it actually increased. The heart rate is 120 beats per minute.
Hmm.
Yeah.
Okay. Has she been feeling dizzy lately?
But tana jin kaman uh, tana ji kamar jiri ne. Okay, she's not dizzy.
She's not dizzy.
Yeah.
Um, have you had diarrhea or constipation? Any bowel problems?
Rachel? Yeah, okay. She does she have tana ji kamar akwai gudawa ne ko na abu? Thank you. She doesn't have any diarrhea or vomiting.
Hmm.
Yeah.
Okay. I think we should run a, we should do, I think we should run,
Do you want us to run some blood tests for her?
yeah, I think we should do a blood test. I think we should do a blood count test first.
Great. So we actually did some tests for her, and one of which is the malaria parasites
Hmm.
that from blood film that showed two pluses of malaria parasites. We also did a complete blood count that showed a hemoglobin level of 9 grams per deciliter,
Hmm.
and the total white blood cell count was within normal limits. The platelets are also within normal limits. And we
Okay.
also did a urine test that showed uh, essentially normal findings.
Normal findings.
Yeah, normal findings.
Okay, so I think I can diagnose you with malaria, and this is not too bad of malaria, more mild, but this means that we need to give you ACT.
All right.
And and to prevent this in the future, maybe wearing long sleeves, long clothes at night, or using insect nets or like mosquito
Mhm.
nets or insecticides at night
Uh,
while you're sleeping.
yeah, wai tana tunanin malaria ne yake damunta, so za a rubuta mata maganin malaria, sannan kuma za ta ke sa dogayen kaya musamman da daddare, take kwana a mosquito nets ko? Yeah. So I've translated everything you said to her. I don't know if there's any other thing you'd like us to add for your patient.
Yeah, I think for the anemia that she's experiencing, I think iron supplements would be most beneficial in this case. And
Great.
I think that she should just be making sure that she's getting her nutrients in her food. I know that's sometimes hard, but I think these iron supplements can help a lot. And just keep her well rested, drink a lot of water, supportive care.
Perfect. Wai tana tunanin kuma kamar ba jini sosai a jikinta, saboda haka za a ɗan bata iron tablets ko? Zai taimaka ya ɗan ƙara mata jini ko? So she's actually very grateful for all the things that you've said about her child. And particularly, I am impressed because of your confidence, the way you carried the interview and finally arrived at your diagnosis. And particularly when you asked her to show her her palms so that you could see if she's pale or something. I think that's very impressive. So
Thank you so
congratulations.
much.
Yeah.
Thank you for meeting me today with me, Aisha, and her mom, of course.
All right then. You're
I hope
always
she feels
welcome.
better soon.
Okay.
Bye.
Yeah. All
Thank
right.
you.
So, yeah. So you're welcome and have a great day. Yeah.
You too.